I mean, as the audience knows, B cells and then subsequently plasma cells, plasmablasts play a key role in disease pathogenesis in NMOSD. It's the B cell lineage that finally produces the antibody, the AQP4 antibody, that then kind of makes the tissue or generates the tissue damage, etc. And then a couple of additional downstream effects. So there was a rationale to look at B cell subsets and plasma cell signatures in the NMOMentum trial, and this was indeed done, and also to try to correlate this with changes in antibody titers, so in serum antibodies to Proinflammatory. We knew from historical cohorts that the treatment response to B-cell depleting therapies, for example, rituximab, that was used for many years prior to these new drugs, then did not correlate well with antibody titers. Okay, and now here, what was done in the NMOMentum trial, there were two approaches. One was looking at plasma cell signatures in both groups, Inebilizumab and placebo-treated patients, and here then it became very clear that plasma cell signatures were measurable in both cohorts, and that plasma cell signatures also were associated with attacks, or peaked around or changed around the time of an attack, especially in patients treated with a placebo, not so in patients treated with Inebilizumab. This was one of the key messages, and the other key point here was that there was a significantly stronger decrease or more profound decrease of antibody titers over the course of the study in patients treated with Inebilizumab as compared to placebo patients. So to sum this up again from a mechanistic standpoint, Inebilizumab has a profound effect both on the plasma cell signatures in kind of preventing peaks of plasma cells and releasing the antibody, in contrast to placebo-treated patients, as well as a profound effect on reduction of antibody titers. And of course, with all difficulties, making individual correlations in individual patients, this clearly provides some mechanistic explanation for the high clinical potency of Inebilizumab to prevent attacks in NMOSD.